Posterior Decompression of Chiari Malformation. Introduction. The posterior fossa is the name of the part of the skull where the cerebellum is located.
Select true or false.
Correct. Please point to the cerebellum.
Choose one of the following options.
Correct. Please point to the spinal cord.
Choose one of the following options.
Correct. The spinal cord runs from the brainstem to the lower back. A Chiari malformation does not always show signs or symptoms.
Select true or false.
Correct. Some people who have a Chiari malformation do not show the signs until late in life, if ever. This may be true even though the malformation usually occurs at birth. A Chiari malformation has a variety of symptoms.
Select true or false.
Correct. The symptoms of Chiari malformation can vary from simple headaches to weakness, paralysis, and loss of sensation. Medications can cure a Chiari malformation.
Select true or false.
Correct. Only surgery can correct the Chiari malformation and help prevent any further damage it can cause. Physical therapy may be needed later to help improve the patient's strength. The surgeon always closes the dura at the end of the operation.
Select true or false.
Correct. Some surgeons do not close the dura at the end of the operation. Whether the dura is closed or not depends on the surgeon's preference. Are strokes and heart attacks common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Are infections very common after surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. Paralysis is common after Chiari malformation surgery.
Select true or false.
Correct. Paralysis is not common after Chiari malformation surgery. However, paralysis, bleeding, and even death do rarely occur, especially if the patient had symptoms of paralysis prior to the surgery. A CSF leak is always temporary and not serious.
Select true or false.
Correct. If CSF leaks, another operation may be necessary to stop the leak.
Thank you for using Explain.